Hello, everybody, and welcome back to the Wild Wellness Podcast, your go-to source for all things women's health, wellness, hormones, fitness, all the good stuff. I'm your host, Haley P, and today we're going to dive into reproductive health, birth control, all the things you never learned in health class about all this jazz, and then somehow ended up on the pill 10 years later. So I'm going to go over some of the common forms of contraception, my experiences with them, and some questions that you need to ask yourself before considering any of them. So without further ado, let's get into it. Little disclaimer before we start, I'm not a doctor. I have had experiences with birth control, and I have heard of other experiences as well of doing in-depth research and studies on birth control methods, contraception. It's very vague, the conclusions right now. So everyone has a very opinionated opinion based on their own experiences, and I completely respect that. You are entitled to your own opinion on things based on your own beliefs. So with that being said, let's get into it. I'm solely going to talk on my own experience with it and the research that I have done personally. Let's define contraception and give you a bit of a lowdown of what it does to your body. So the most common form of birth control is the combination pill. And that is a synthetic form of estrogen and progestin, not progesterone. They are two different things. And essentially, it's supposed to trick your body into thinking that it's pregnant. However, your hormonal patterns look a little bit more like you're in menopause. But there are other forms of contraception, like the mini pill, which is just progestin, IUDs, implants, the ring, everything. There's so many things. But most of them actually are synthetic forms of hormones. And there are only a few that are not, one being the copper IUD, which I do have experience with, and I've heard of people loving it. I personally did not, but I will get into my story later. And then there's also something called the fertility awareness method, which is becoming a little bit more widely known in the health and wellness space as women start to embody their own hormonal patterns and start to follow that. And so essentially the way your body works, let me explain this a little bit. The pill will take away ovulation, and ovulation is the only time that you can get pregnant. Your body goes through 4 phases. One being menstrual, which is when you're bleeding and you're not fertile usually during the menstrual phase, but there are rules to follow in terms of the fertility awareness method. If you want me to go in depth with that in another video or episode, please let me know. Comment, like, subscribe, DM me on Instagram. I don't care. Just somehow let me know you want to see an episode like that. But you will not be fertile when you're in your menstrual phase. Then you head into the follicular phase where your body starts to grow the follicles for ovulation, and one of those follicles will release an egg at ovulation time. So there are 2 main components that you need to look for in terms of the fertility awareness method, one being cervical fluid, which is kind of like discharge, I'd say, and the second thing would be your BBT, your basal body temperature. And this is the temperature you take right in the morning before you get up, before you drink water, before you go to the bathroom. And what will happen after ovulation is your temperature will spike, and then you will enter the luteal phase. So essentially 3 days after that spike happens, you will be considered infertile because the egg only lasts about 24 hours and then it dies. So no egg, no pregnancy is going to be made. So that's how the fertility awareness method works in a nutshell. And then what contraceptive does is it takes away ovulation, so there is essentially no chance of getting pregnant. However, all of them have different effectiveness rates. The pill, I believe, is 98% effective when used correctly, meaning that you take your pills. IUDs are 99%. And the fertility awareness method, if you do your due diligence and you learn about it, will be also 98% effective. However, doctors will probably not suggest you do that method because there is a lot of room for human error. So that's just some choice that you're going to have to make. There's always a price to pay. You either pay the price of having the symptoms and side effects of hormonal birth control or IUDs, or you pay the price of doing your due diligence, learning your own body, and learning to be confident in the fertility awareness method. So those are the main forms of contraception. Also, I left one out, which is condoms, obviously. No one thinks those are contraception, but they are. Um, so that's also an option, though I don't know anyone who likes them. So I'm going to move on to my experience with contraception. And in terms of my own health journey as well, because a lot of women go on the pill to heal their hormones, quote unquote, does not heal your hormones. It just puts a band-aid on the forest fire, or pours gasoline on the forest fire would be a better analogy. Especially my girls with HA, I see and hear so many doctors just prescribe the pill and thinking that they're broken in some way or they're too active. Like, it's a very common thing for athletes to not have their period, go to the doctor, and they just get put on the pill and think everything's normal. This is normal for athletes when it's not. Your period is your fifth vital sign, like your reproductive system, and it should not be missing, and it should not be synthetically induced for health reasons. I definitely believe in a more holistic approach to it before going to pills. I think there's space for, the Western form of medicine and, pills and medication. And then there's also room for the holistic approach, which I think you should take before looking at any kind of pills or going straight to the pill route, because that can kind of, again, add more gasoline to the forest fire. You end up on the pill for 10 years and now you want to get pregnant and you can't because your period's still not there and you can't ovulate regularly. And then you're spending $30,000 on IVF. So I think this is a whole thing that everyone can avoid, essentially, if you guys just educate yourself. So I'm glad that you're here and kind of getting some insight on reproductive health and contraceptive, and knowing that you have a lot more control than you think you do. So into my own experiences with birth control. I was offered the pill, never took it when I was going through HA recovery because I did not have my cycle and I knew that it was just a band-aid method. So I did want to do it holistically. I wanted to gain some weight. I wanted to increase my calories because deep down I knew that doing the dirty work I was going to be better off doing the dirty work then than later on taking the pill, band-aiding it, and continuing on in my disordered eating habits and mindset. So I bit the bullet. I did not take the pill and I got my period back naturally. And that's something that I teach my clients how to do now as well, because it's so important to me. And that's something that I'm very passionate about. However, I am also a 25-year-old woman who, needed birth control at some point in my life. And so I've been on some IUDs. I tried the copper IUD first because it is non-hormonal, and that was the route that I wanted to take. So let's start with the insertion. And I've also had the Kyleena IUD, which is a hormonal IUD. Insertion was a lot different then. So in a nutshell, it's just a very invasive process. And the copper one was pretty smooth. The Kyleena was a time and a half, and I would not wish that on anybody. I'm not here to scare you. Everyone experiences it differently, based on your pain tolerance and what you're able to endure. But I did not have a good time with it, as I don't think anybody does. Hear of a lot of people fainting and stuff, not to scare you again, but so anyways, insertion was just very invasive and uncomfortable. And with my copper IUD, I had it in for about 6 months. And what I was told was that it would increase my flow, which it did, and it would increase my pain, which it did. And I knew this going into it, but I decided on the copper, one, because it was non-hormonal, and two, because I didn't have very painful periods in general. So I was like, okay, a 10 to 30% increase in pain and flow, I can deal with that. No, I can't. I couldn't deal with it. After 6 months, I had to take it out. because I just didn't want to waste my life feeling like that. So it definitely fatigued me more, and my PMS week was freaking horrible, and I hated it. I hated life, and I wanted to take it out, so I did. And then I tried the Kylena IUD, which insertion was a lot worse. And they eventually got it in after 2 visits to the doctor's office. But it made me bleed for about a month straight. So that was one of the side effects that I was warned about. And I endured. It was very light bleed for the month. And then I started to bleed regularly every 28 days, and I was cycling regularly. So it didn't stop my ovulation. And then I got to, I think, month 8, and it did. It stopped ovulation, and I was not cycling anymore. So the thing with IUDs, depending on the amount of progestin in it, so the Kylena, I think, is the middle of the pack. Mirena, is that how you say it? It has the highest dose of progestin and usually stops ovulation. The only difference is from that and the pill is it's 1, only progestin, and 2, it's delivered locally into the uterus. So if I had to choose between the pill and the IUD, I'd choose the IUD. But then you also have to endure the, the insertion process of it, but it is very low maintenance. So that's something that you, again, have to decide on your own personal time and discuss with your doctor, everything like that. So it did take away ovulation for me, which I did not like at all. So after, I think, month 8 or month 9, I took it out. I was also getting really bad acne. And I think one of the problems for me as well was, since I came from such a low maintenance period to begin with, like I didn't have any cramps, I didn't have any acne, like my periods were very pain-free and carefree, and they are now again because I don't have the IUD. They started to become a little bit more annoying, and I didn't like it. I was like, is this how the other side lives? I can't handle it because I've been so blessed with such a nice period. And, obviously I've done the work internally to make it that way. I didn't want to endure the symptoms, so I took it out as well. And since then, I've been doing the fertility awareness method, which I love. I use the Daisy fertility tracker. I do have a discount code. I'll link it below. You get $15 off. But essentially what it does is you take your temperature every morning, and rather than you having to chart your cycle yourself, it will tell you if you are fertile or you're not fertile. One thing you have to do though is go through about 2 to 3 months of just it learning your body and learning when you ovulate, because usually you will ovulate on a pretty regular basis based on your own body. So for me, that's day like 19 to 20. Some people ovulate on day 14 to 15. So it just depends on your own body, but it will calculate that for you based on its algorithm. And it is very effective as well. So that is an option for you if you don't want to do all of the charting yourself. However, I really, 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 really suggest you do learn yourself, just so you can have that ease of mind and peace of mind going into it. There is a book called Taking Charge of Your Fertility, and that is like the Bible of the fertility awareness method. I highly recommend you read that. I will also link that down below if you are interested. So those were my experiences with the birth control methods that I have used. I have extensive written articles on my blog if you want to read about it. But there is a lot of flack about the birth control pills, and I did want to address that a little bit as well. So the studies show that it's pretty inconclusive and based on the person. The one thing that I don't like about this day and age is, especially in Canada, it just got passed that birth control is just like an over-the-counter pill that you can just go get from London Drugs or whatever. And I really disagree with that because I think it should be screened a little bit more. There are a lot of side effects, and it can cause blood clots and all of this jazz. And it doesn't, of course, it does not cause it for everybody, but there are people who it does cause some pretty life-threatening issues. So I think it should be screened a little bit better rather than handed out like candy for people to have as like a magic pill. I think a lot of us want a magic pill to fix our problems. And the birth control pill is the magic pill for our hormonal issues, which it shouldn't be. I highly disagree with that. I think there's space for it and it is needed in some cases, but it should not be the main course of action in terms of balancing your hormones or getting your period back or regulating anything. So those are my 2 cents on that. There's also talk about it causes infertility, but there's a lot of inconclusive studies that proves so it doesn't necessarily cause infertility. It can, but again, if your hormones are all whacked out before you go on the pill and then you come off it, likely they will go back to being whacked out based on your behaviors and your habits that highly impact your hormonal balance. So that's something to take into consideration, as well as nutrient deficiencies. That is a common thing that the birth control pill does decrease, is your gut health. And there have been several studies investigated whether women on OCs, so oral contraceptives, need different amounts of vitamins and minerals. It's been shown that the key nutrients that are depleted are folic acid, vitamin B6, 12, vitamin C, E, and minerals like magnesium, selenium, and zinc. So these all have a very crucial role in your body, and being deficient in those can cause a host of other issues. And I think a fun fact, and something that isn't really associated with the birth control pill but should, is women on the birth control pill are 3 times as likely to be also prescribed antidepressants. So if you are on the pill and wondering why you're so anxious or depressed, definitely could be because you're on the pill. And, if you already don't have the best diet, you're likely deficient in a lot of these vitamins and minerals, right? So a few things to take in consideration before even thinking about going on the pill. One, are you sexually active? Like, do you need to use it for the purpose of being on a birth control pill? Your lifestyle, what your values are. Do you value your health and your wellness and your longevity in terms of your reproductive health? Because I disagree that, birth control pills are the best route for that. And honestly, 3 would be have a good doctor that you really trust. A lot of doctors just kind of push off the pill, and just here, this is the best thing for you, and not really do any other digging in terms of your past or your other health issues or what your beliefs and values are and what the side effects might be. So you kind of have to be your own advocate as well in terms of deciding what birth control method is most beneficial for you. It's different for everybody. It's very important to remember and to have that trust with your health practitioner and your doctor. So, but there's definitely 2 sides of the story: the people who absolutely despise the pill and people who are advocates for it. I kind of fall in the middle depending on your situation, because everyone, again, is so different. I personally would never take it myself because just from what I know and what I've learned and the side effects that I've had with such a low dose of progestin in my body, just don't like it, don't think it's necessary. I don't think it's needed. And those are just my 2 cents, my opinion on it. And I think it should be discussed in health class for younger girls, and just in general, it should be more of an open topic because, again, like, we get fed this birth control pill or the hormones thinking that it's going to balance out our hormones because we're somehow imbalanced on our own, and you might be, but there's definitely some behaviors or habits of your daily life that you can fix in order to balance your hormones naturally rather than just turning to pills. So I don't think pills are the answer to everyone's problem. There is space for them, but not always. You know what I mean? So those are kind of my 2 cents on this whole topic. But there's also, like, listening to the internet, and there's so many different opinions. Always take things from the internet with a grain of salt because, again, the studies on the birth control pill are a little bit inconclusive in terms of the long-term side effects of it and it causing infertility, because the pill has been around for a very, very long time, and it's very studied. But also, when you're reading and listening to things on the internet, everything, take it with a grain of salt, because everyone has different beliefs and paths based on past experiences that are not always science-based, okay? So that wraps up today's episode on women's health and birth control. I hope you've gained some valuable insight on this whole topic. As always, thank you for tuning in. Be sure to subscribe to the Wild Wellness Pod for more informative episodes on health, wellness, and everything in between. Until next time, my friends, stay healthy and keep those metabolic fires burning.